Rick Whittingham is my boss. He's the VP of Operation for IVF Florida. So you know how companies work, everything goes through him. And he tells us what to do and where to do it and everything else. So you know, we're very happy to have him coordinating the day-to-day activities that we do. We do the clinical part, but everything else, like you all know, takes place with the team. So it's a team effort. We couldn't do anything without everybody, from the receptionists to the nurses, the MAs, the administrators, everybody. So IVF Florida is, it's a large company, but we want to make sure that everybody feels like it's a large company, but you have personalized care. And the reason that we, feel that that's important is because there are a lot of things going on. There are a lot of components, and you don't want to be talking to too many people, and then you feel that nobody knows you. So we have teams, and depending on which office we go, Coral Gables, Pembroke Pines, Margate, Wellington, Jupiter, Boca, Port St. Lucie. These are all places where we go see patients, and each of the doctors on the teams are going to go to a few of them. Most of us go to 2 or 3, and in each office we have a team. So the patients that are going to Coral Gables or Port St. Lucie, they will always interact with the same physician, 2 nurses, an MA. And that's, what we do all the time. So when they call, they know who they are, and vice versa. So you feel that that's extremely important, so everybody feels that they don't have to be telling any things to everybody again over and over. When it comes down to donor eggs and gestational carrier, we have one team just for that. So when we see patients, we take a history, we do the physical exam, we go through the ABC of understanding everything that is going on from a medical point of view. And then once we make a decision that a couple, regardless if it is, single male, females, heterosexual, same-sex couple, for us, we look at the same testing, the same, evaluation, the same exams. Once we make a decision, yes, they are interested in, doing donor eggs or gestational carrier or any other treatments, then we put them in touch with the donor recipient team, which is just dealing with that. So what we're trying to do is make sure that like I said before, everybody's on the same page, and we know the patients, and they know us, and they know the team. And there's a lot to learn when you go online and you got a Dr. Google or Dr. Yahoo, and you try to learn everything that you need to know. Everything is out of context. So we need to explain to you exactly what is you need to know and how we could help you based on what your needs are. Once we accomplish that, then we start, getting out of the list of things that we need to do and check it off the list. Some of the patients will have a friend that will donate eggs. Some of them will have a carrier that will carry the baby. And there are some, restrictions. There are limitations. There are legal, issues that we need to, keep in mind. We can do true surrogacy, which is using the same female for the eggs and carrying the baby. And we could, talk about that if anybody has any questions about that. And then the process takes place by making sure the sperm is normal, making sure that we have the eggs, making sure that we form the embryos. And there's nothing magic that we could do. The embryo is formed by whatever the egg and the sperm want to do. We can't change that. Can't change chromosomes. We could detect the gene mutation. We could detect, chromosome anomalies. We could do a lot of things that nature is already doing. So we could just, take peeks at different stages of an embryo development, and then find out if the chromosomes are normal, freeze the embryos, have them. So then we know that we having the lab eligible embryos for transfer. And then we could look at the gestational carrier, which is the most expensive portion of doing, donor egg and GCs. They're excellent companies. We work with, almost all of them. And it has to do with, medical aspects more than anything. There are no preferences. There's not one company that, we work with. And the reason why we don't have everybody in-house is because we don't want a conflict of interest. We want to make sure that when a gestational carrier company, send us patients, they have their own, rules and regulations and everything, and then we have ours. Same thing, from a financial point of view, we want to make sure that we are looking at what is in your best interest, the carrier's best interest, and the future baby's best interest. So we work with all these, different components. We call the shots. Ultimately, we are the ones saying, when we are going to, thaw the eggs, fertilize and form the embryos, biopsy the embryos, get the gestational carrier, make sure they qualify. They could send us a carrier from a company that by all means is eligible. We have to make sure the uterus is fine. There are no risk factors for her, the future pregnancy. So there are many components. That's why the donor-recipient team is probably the best team to be interacting with all the time. And then we transfer an embryo. And in order to transfer an embryo, we want to make sure that the uterus is ready for an embryo transfer. So there's a process for that. We don't expect anybody to know what we're going to be doing, so we sometimes overdo it. We explain to everybody what is going to take place. How do we prepare the carrier? What is the estrogen, the progesterone, the lupron used for? And I think the most important thing is expectations. I mean, we could only do what nature will allow us to do. And having a pregnancy and having that pregnancy go all the way to term is what we all hope. From your point of view, you do everything. There's nothing that we ask you to do that you just don't do, because otherwise we can't go forward. On our end, we do everything. I mean, we just don't take any shortcuts. We don't do anything in a rush. We want to make sure that if there's a better way of doing what we do the next time around, it's this time around. We just don't want to do anything more than once. And the ultimate outcome, is nature. We just can't force things to happen. So there's always that, unknown out there. We get a pregnancy, we get a positive pregnancy test, we get doubling time, we get an ultrasound, we do heart tones, we could get a pregnancy loss. And it's not because somebody's doing anything wrong. It's just that happens in the real world with any pregnancy. And the same thing during pregnancy, we send the patients back to an OBGYN when they're around 8 weeks of pregnancy, because they're outside of the most risky, portion of early pregnancy. Beyond there, hypertension, diabetes, placenta previa, things that happen in pregnancy. So there's always a sense of, when could I really breathe comfortable knowing that everything is fine when the baby's born and everything is normal. But that's how we all feel, because in medicine, you're always looking at the glass half full on everything that we do. You don't want it totally full. Sometimes it's half empty and things are still fine. So every time that we talk to any couple or any single patient, the bottom line is things are where we want them to be. We're very excited. We're very optimistic. But we have to keep following all the normal pregnancy follow-ups, and medicine is always like that. I mean, it's just the glass is half full. That's great for us. If it is half empty, it's because there are issues like somebody has preterm labor, or somebody doesn't have adequate doubling time, or the ultrasound doesn't look that great, but it's still going. So we work with anything, and you need to have a team behind. All these that is very supportive, very understanding, and they could explain everything to you as far as medicine and science, but then everything else around that. So you have to feel that there's nothing that anybody could be doing that we are not doing, and that you are really, really taken care of, like if you were in the best possible place. How to choose that place? There are many people that are doing what we do. We feel that we do the best we can, and we have a great team. And we're more than happy to talk to you anytime and try to help you. So I'll answer any questions that you might have.
Questions? Do you have any kind of idea? Well, I know you have an idea, but what are your success rates with screening?
The pregnancy rate is changing as technology is getting better, and our pregnancy rate is very good, and it has, the outcome that we want because of the team that we have. 50% of that is the lab, and when it comes down to IVF, almost 100% is the lab. Once we get the sperm and the egg, is in the lab's hands. Now our pregnancy rate on patients that are using donor eggs, which are eggs under the age of 32, with egg reserve perfectly normal, and the sperm is fine, even if we need to do severe male factors where we have to extract sperm from the testicles. If the embryos, develop to day 5 and they're blastocysts, that's the only stage where we could biopsy an embryo. And then if the chromosomes are normal, pregnancy rate could be anywhere from, 60, 70, 80%. So if we don't do a biopsy of embryos, I will say 50, 60. If we do a biopsy of an embryo, maybe 70, 80. Everybody has the same pregnancy rate? Hell no. You can't. You can't because the way that I'm putting it to patients based on things that we find out lately is we were getting embryos from other centers. Okay? Somebody comes in and says, I did IVF, I have a normal chromosomal embryo, could you put it in? Insurance companies are sending us those patients. And the reason why they send us those patients is because some other centers have lost the Center of Excellence accreditation, so they don't want to pay for it. But they'll refer those patients that did IVF somewhere else to us, so we could transfer those embryos. And then we don't get pregnancies. And we're doing everything the same. And on the same day, 8 out of 10 patients get pregnant, and these ones with normal embryos, with normal chromosomes, are not getting pregnant. So we were like, there's something that is not right here. So our chief embryologist, Kathy Miller, which is known all over the world, goes all over the world, improving IVF centers. And she realized that lately we have more information about all IVF centers because everybody's sharing more what we do. And then when she's doing consultations to improve IVF centers, she realizes that not everybody's doing the same thing. Not everybody thaw the eggs in the same way, fertilizes the eggs with ICSI. Mainly, not everybody's doing biopsies in the same way. When you shoot an embryo with a laser, which sounds, scary, it is scary if you are shooting it with, not 2 or 3, laser pulses to get a few cells, but you shoot them with 15, 20. You're frying that embryo, right? Now, that embryo survives, and you freeze it, and then you thaw it, and it's alive, and it's expanded. But guess what? You're going to pregnancies. So when it comes down to pregnancy rates, one example that I find that, practical for my patients is, I don't know much about food, but a lot of people know a lot about food. So you could have a Peruvian cuisine, a French cuisine, an Italian cuisine, some of the best ones, right? Are all those the same? No. You go to a French restaurant, are all the same? No. The restaurant is great. The owner is wonderful. The waiters, everybody's great. You want to know about the kitchen. You want to know about the chef. That's what you want to know. And not only that, but you want to know if the chef, 2 years ago, when you reported all these pregnancy rates, is the same one that they have right now. So I tell all my patients is, you pick restaurants if you really care about the food based on the kitchen. Forget about everything else. You go to a hole, but they have the best pregnancy rate. IVF Florida is not a hole, okay? We try to have the best on both ends. But the most important thing when it comes down to your question is pregnancy rate. And the pregnancy rate has to do how do you treat the eggs, the sperms, the embryos, how you freeze them, how you thaw them, how you do everything, and who's doing everything, and who's doing it now. So whenever you go anywhere in the world, that's what you need to ask. What is your pregnancy rate, and who's the people doing it with that high pregnancy rate? That was a really long answer for a simple question, but that's what's going on. Okay, apples, oranges, perfect example of what's going on with our pregnancy rates. They're not the same. Reason why we don't get any embryos from any South Florida lab that want us to transfer those embryos. We don't. Patient comes in, they have 3 frozen embryos, normal chromosomes. First day, we meet with them, we don't even charge them. We just tell them, we just can't. Because with all honesty, we can tell you that we'll offer you a 60, 70, or higher pregnancy rate with euploid embryos that we don't even know how were they treated. Now more than ever. So we don't. Every time that a couple comes in, they have frozen embryos, our head embryologist is going to let us know if we could take the embryos or not from anywhere in the country or the world. Because we want to offer patients, with all honesty, what the pregnancy rate will be if we are the ones, doing the other end of the embryo transfer process. Now, you can't find any of these things in Google or Yahoo or, other places. This is fairly new. I will say, 6 months, less than a year, that we've been just, having a really hard, position on what we want to do for patients. Questions? No?
Yeah, specific questions about your own situation, you can schedule a consultation either with Dr. Nuevo today or one of our third-party team, or tomorrow we maybe convert that.
And then every case is different. I mean, what you want to know is, if I'm planning on doing this, but I'm not sure, that's when you need to go talk to somebody. You want to make sure that in your case, what is involved, how much is it going to cost, how long is it going to take, what is the process about, and then you decide to do it or not. But the worst thing you could do is just, be wondering, should I go see somebody? Should I, talk to somebody? Just do it, get it done, and then you decide if it is something you're going to do or not. You have to look at the medical aspect, the emotional aspect, the financial aspect, and time frame. I always talk about those four, legs of a table, because those have to be equal. Shouldn't be wasting any time. Shouldn't be, wasting resources. The emotional roller coaster shouldn't be because of, not knowing these things. And the medical aspect is not how, wonderful the centers are, but what the limitations are. So you want to know what are the biological limitations and the center-specific limitations on what you're looking for. That's how you live your life. When you fly, when you pick hotels, when you go traveling, you just don't go anywhere just because they have a good sign or a good web page or somebody told you, I had a good time. You look at everything. You don't put a dollar into anything unless you know that you're going to the best place. This is, even more critical.